Good morning, and it is a pleasure to be here this morning with Harris County Public Health and Environmental Services with all of you on a nice, sunny, bright, 80-degree day in Houston, Harris County. Yes? Yeah, okay, I'm deluded as well. So it is not as 80 degrees and it's not sunny, and certainly it is still a Friday, so that's the only good news. You do have the weekend ahead of you. And what I'm going to do is just take a few minutes here this morning and really present on Ebola and Ebola-related activities here in our department and our community to give all of you a little bit of an idea about what's happening around Ebola. How many folks, let me, before I start, just say, had you heard of Ebola prior to the last couple of months? How many folks in the room had heard of, been watching it? How about last year, 2 years ago, 10 years ago, 20 years ago? Okay, Steve Cathy in the back is raised. Once I said about 20 years, he's like, I was still watching Ebola 20 years ago. And the point is that Ebola has actually been around since 1976, okay? So it's been around for a number of years, and so you may only be hearing about it over the last several weeks because of what's been happening in the US, but we have to keep in mind that this is a virus that's not new to us. This is a virus that globally has been around for some 40 years. So that's actually quite a bit of time for us to get to know it and to know how it works and how it operates. But what I'm going to do is really take a little bit of time to describe what we know to date and also to give a little bit of kind of some of the history of Ebola. I won't get into too much of the doctor speak so you guys don't get too bored, and if anybody falls asleep, please raise your hand before you fall asleep so I know that I just need to know that your eyes are closed for a particular reason. So I won't call on you. And I also will then go through some of the really the latest information that we have and some of the changes that have been happening over the last several, in fact, some changes that have occurred even over the last 72 hours. So there's stuff that's been evolving all the way throughout this process. So again, as Jesus has mentioned, we are with Harris County Public Health and Environmental Services, and when I say we, I do want to also introduce a couple of our staff members who are here. In the very back with a camera, first of all, is Sandy Catcher with our Public Information Office. Sandy is here, and we have a number of materials that our Public Information Office have put together, and in fact, I think a lot of you have them. I see a lot of the materials already there, so they've done a fantastic job. Sandy, thank you for joining. And we also have Dr. Deanna Martinez, who is our Chief Epidemiology Program Manager, Senior Epidemiologist, our epidemiologist guru, who has actually been very much working in epidemiology, and I'm going to actually ask her to come up at the very end for just a couple of comments, because I think it's really important that Deanna and her group work very closely with a lot of the schools and your school nurses, and it's really good for you to at least know her face and know who she is, and also hear some of her perspectives on how we can work more closely together. So just a couple of folks, Andy and Deanna. Absolutely. In fact, our team, I think, gets really a lot of credit for what's been happening over the last several weeks. So I'll describe that in more detail. So just before we get started, just to let you know that these are, at the bottom of the slide, it's a little bit hard to read, but these are our priority health issues over the 5 years from 2013 to 2018. And I'll read them out: chronic disease, food safety, emergency preparedness, environmental health, infectious disease, injury, and social, mental, and emotional well-being. So the reason I read those out is that when you look at that, emergency preparedness and infectious disease are the two areas that Ebola really touches over the work that we've been doing. But it's really critical to remember that a health department such as ours does a lot of stuff. And a lot of stuff that we do really is about how do we actually keep a community healthy, keep a community protected, keep a community free of disease, and at the end of the day, promotes the health of our community. And I'm going to describe that in just a minute, but I want you to remember that as we're working on Ebola, we still have to work on chronic diseases like blood pressure and heart disease and diabetes and things of that nature. We still have to work on environmental health and make sure the restaurants are safe and that you can eat there safely with your, with your families. We still have to work on animals and making sure that dangerous dogs are picked up and we can pull them away. We still have to think about mosquitoes and West Nile virus and mosquito season. Those are all the things that our department does. So this is just one sliver of what we do, and it's not all that we do. So you got to remember, everything that I'm going to be describing is in addition to everything else that we're doing right now as part of a health department. And so I think that's a really important piece to remember. So first of all, how many folks in this room, by the way, I like to walk around. This is kind of nice. It's almost like I feel like I'm ready to do some gymnastics, but I'm going to jump down here a little bit if that's okay. Because I like to be a little, I know, everybody's like, oh no, could you please go back up? Why did he come down? But I want to, is this going to mess up the camera? Are you going to be okay over there? You're fine, okay. So what I want to do is to really be interactive. And I like to be closer to everybody. And so what I want to start by saying is, what do folks in the room think is public health? What is public health? And I shouldn't have shown the definition, but I already showed it, so you guys already know. You guys, for the folks that are like looking ahead, they're like, oh my gosh, he's already given me the answer. So what is public health? It's what we as a society do collectively to assure the conditions in which people can be healthy. Good. Wow, you guys are, this is good. This is good. What this is really, what public health is about, how many people in the room think that they're a part of public health? Oh, it's only like 50% of the room. It's not good. We gotta work with them, right? Everybody should be raising your hand. We're all a part of public health. So it's not that public health is just what government does and what the health department does, but government and public health and what the health department do, we are just a part of it. Public health is what all of us do to create those conditions so that when we're thinking about our families, we're thinking about our schools, we're thinking about our kids, that we can really think about how do we promote health, how do we promote a healthier community, healthier society, a healthier neighborhood, a healthier children, healthier places where people can live, learn, work, worship, and play. And that's what the health department is about, but that's really what all of us together are about. So that's an Institute of Medicine definition of what is public health. And just to kind of let you know is, and now it won't, I guess I gotta get closer. So when you think about public health and you think about health care, a lot of times people might get a little bit confused. So I'm gonna show this. Not sure where I'm going. There we go. Show this slide so you guys are aware. So as a physician, as a doc, if I see patients, and I'm seeing patients on the right side of the table here, I see patients as part of medicine, right? The individual patient, whether it's in a clinic, in a hospital, an emergency department. When you're in front of me, I am worried completely, specifically about you and your individual care. I'm not concerned about anything else. I'm thinking about your blood pressure. I'm thinking about your cholesterol. I'm thinking about your diabetes. I'm thinking about your immunization because you're my patient. In public health, what we do is it's called population health. The community is our patient. So we're concerned about all of the different challenges and all the issues that might affect the community's health. And Ebola, obviously, is one of those infectious diseases that's of concern. So we used to say that this was a public health versus healthcare, but it's really not versus healthcare, it's and healthcare. I want our docs and nurses and all the other folks that are on the front line in health, in our hospitals, in our emergency departments, to be strong, to be good, to be fantastic, to be, when you come to the emergency department, we want them to be the best doctors and nurses that they can be. But public health, on the other hand, is each and every day working on all the things behind the scenes so that we can actually help the doctors and nurses and the hospitals and healthcare system to be as strong as they can be and to treat our community as a patient. And so when you think about West Nile virus, when we're thinking about the kinds of things we do in the community, West Nile virus is an example, right? So we spray in the community for mosquitoes. We do that because we're concerned about mosquitoes possibly having diseases that might actually transmit to human beings. And that's why West Nile virus is something that we do as part of what we try to contribute to the community's health. Does that make sense? Okay, so that's just two slides. I have like 80 more. Just kidding, I don't have any more, but you guys are already freaked out now. But the point being that I wanted to spend a little bit of time on that, because before we even launch into Ebola, we have to remember what the role of population health is. And obviously that's an important thing, because we want to remember that, again, where people live, learn, work, worship, and play, those are the places where you have health that happens, right? So if you see me as a doctor, I may see you once every 3 months, every 6 months, every 12 months. I'm going to send you back into the community, and that's where health really happens. Okay? Are we good with that? Ready? Okay, good. Now let's talk about the stuff that I'm supposed to be talking about. Is that right? So, and I should just mention a little bit about our department. We are the County Health Department. As you know, that our community is quite big. We have a community that's, well, 4+ million people. We're spread over the size of Rhode Island. We are very diverse in every way that you can think about. And our health department is the county health department for the Harris County jurisdiction. And we have a staff of over 600 people that are handling all the community health needs that we need to be working on. And so let's go to sort of the main reason that I'm here. And the reason that I was actually invited, Jesus, was to speak about Ebola, not about anything else. So let's talk about Ebola. So how many folks in the room feel they have a good handle on Ebola? All right, so we got some work to do. By the end of this, I'm hopeful that all the hands go up, and at least you have, at least lie to me, tell me you have a much better handle on it. No, I'm kidding. No, I want you to have a much better handle on Ebola by the end of this. So let's start by just some Ebola 101. So Ebola is a severe, often fatal disease that's transmitted through a virus, okay? And it's very, very simple that it's not spread through air, water, or food, but direct contact. Direct contact either with a sick person, so remember that word, sick person, somebody who's ill, or the body fluids of somebody who is sick. And these are all the body fluids that you can think of that somebody who has Ebola could potentially transmit through. There's no specific medicine or vaccine currently for Ebola, okay? There is nothing. There are a lot of experimental, we're doing a lot of different trials, we're even taking some medications that we think might work. They're not FDA approved, but we're throwing it at patients with Ebola with the hopes that it will help because of the fatality of Ebola itself. And it's not contagious until symptoms appear, okay? So just keep that in your mind, that unless somebody has symptoms, they're not able to spread that disease to somebody else. That's a really critical piece. So a lot of what we know about Ebola is from Africa, because that's where the outbreak has been going on. And what we do know are these are the symptoms that after exposure, within what we say about 3 weeks, that's why we always say 21 days, these are the kinds of symptoms that you're really concerned about. You're concerned about having fever, headache, GI symptoms, diarrhea, vomiting, stomach pain, muscle pain, and then when the disease actually advances, you start to really get concerned about what happens is that the virus starts to attack certain blood products within the blood system, including platelets, and platelets do what? They help you clot. That's right. They help you stop bleeding. Absolutely. So when you don't have those platelets, guess what happens? You start to have people who wind up having bleeding, whether it's internal bleeding or external bleeding. And that's what is obviously of concern in a more severe illness. So a little bit of a busy slide, but just to remind you, as I talked about previously, is that Ebola was first diagnosed in 1976. At the Ebola River, that's where the name comes from, that it was diagnosed, characterized, and in 1976, the Ebola virus was first characterized, and what happened is that from 1976 moving forward, we had multiple episodes over the decades where you've had small contained outbreaks. That's why in the 70s, in the 80s, in the 90s, in the 2000s, and even prior to 2014 in 2010s, we've actually had smaller outbreaks of Ebola in countries in West Africa. But the good news is those outbreaks have been really contained because they've been mostly in remote villages, tropical rainforests, and they've been in situations where we've been able to find containment. But it's a really important thing to kind of look at this graph, and I'll have to look at it with you guys, is that the natural reservoir of Ebola virus is in the bat. Okay, so these sort of bats kind of do their thing. They spread them to each other. Bats like spreading things. They spread them to each other. And guess what? Once they spread them to each other, and you get like a primate that might come into contact with that bat, that primate might get Ebola, maybe not get too sick from it, may go into other smaller mammals, and now you got Ebola maybe circulating in a couple of animals. And what happens then is somehow the human being population gets closer to one of these two populations, or may even be eating one of these animals, and the next thing you know, now you have a person who has Ebola, and then that person now is part of the mix for potentially spreading Ebola to somebody else. And so that's how it starts to spread, and that afterward the spread from person to person again happens only with direct contact with body fluids. And so again, the other thing to keep in mind is that the outbreaks in Africa are really related to challenges in the health system in those countries. So there are some challenges. The countries do not have the resources. They have health systems that have been deteriorated and decimated, and there have been challenges with when somebody shows up, you might be able to first initially contain and say no more transmission, but because you don't have as strong of a health system, don't have that kind of containment, and now you have one person to another person to another person to another person, and now you have an outbreak that's happened. So previously, the other last thing to say is that the rates of fatality of deaths have been as high as 80 to 90%. Okay? So you kind of take the 8, 10 people in this room, and basically 8 of the folks in this row would be dead, where 1 or 2 would survive. That's the reason why people are so concerned about Ebola, is that once it spreads, it can be a really highly contagious from the standpoint if somebody gets infected once they're sick and they spread, you can actually have high death rates, and it can also be quite challenging because you've got people that might be bleeding from eyes, might be bleeding from noses, might be bleeding from mouths, might have internal bleeding, and you start to really get all the horrific pictures that we remember from Ebola. Okay? That's what we know in the past. But here's what we know now. And this is really updated as of just yesterday, is that we have the largest Ebola outbreak in history. And it's mainly occurring in 3 countries, Guinea, Sierra Leone, and Liberia. These are the 3 countries in West Africa. And we've had 15,000 plus cases and 5,000 plus deaths. So how many folks in this room are good at math? Okay, now I just talked about an 80 to 90% death rate. Does that look like 80 to 90%? It does not, right? So that's about 5 out of 15, 1 out of 3. That's about a third, that maybe 30, 40%, right? So what that is really owing to is that although we've had a lot of transmission this time around, the actual fatality rate, the death rate, has actually been lower. So even though it in the past has been up to 80 to 90%, the death rate now is actually lower in this outbreak, even in West Africa. Okay, even in West Africa. So I'm not talking about the United States, where we have lots of great health system and you know, folks that are doing a lot of things. I'm talking about even in West Africa, the death rate is much lower in this outbreak than previously. And the World Health Organization, the CDC, other partners are obviously responding. And these are the other countries outside of it. It should be noted here that Nigeria is a country that gives us hope. So, how many folks know why Nigeria gives us a little bit of hope with Ebola? They haven't had a case in a while, that's right. So what happened is, Nigeria is a country right next door to these 3 countries, and guess what? Lagos is a country that has over 10 million people, and people were worried that you would be able to get Ebola into a major metropolitan area, and then it would spread like wildfire, and then that's it, you're in trouble. Now it's going all over the world, right? But what's happened is that Nigeria has actually been designated Ebola-free. that they have actually been able to contain the Ebola virus, which gives us hope around the world that if one country is able to contain it, then obviously more countries can contain it as well. And so Nigeria is not one of the countries that are in the list of 3 that we, again, Guinea, Sierra Leone, and Liberia. But Mali is a country that, and remember I said in the last 72 hours some things have changed? What happened in Mali is very, very unfortunate, but Mali is not sure exactly which of these countries is Mali now, because we don't have it labeled on here. Does anybody remember?
Guinea, right outside Guinea.
Right, it's this one?
It's a border with Guinea.
Is that the one?
Borders Guinea. It's really known in that map. It's right in the green part above Guinea.
Right here? Help me, Deanna, right here. Make sure I got here. Here?
Right.
Okay, around Guinea. Around Guinea, how's that? And what I want you to know is that what's happened is you essentially had you had a person who went over into Mali from Guinea, and that individual died of kidney failure. Okay, and they said, okay, person died of kidney failure. We're going to take the body, send it back to the original country. But what happened is that right as they were about to send the body over, 2 nurses taking care of that patient wound up contracting Ebola. And all of a sudden, folks said, whoa, whoa, whoa. This person didn't die of kidney failure just by natural causes. It's actually Ebola. And now the CDC is working with the partners there because the real concern is that you have a concentrated focus outbreak that's occurring in that country, specifically related to that hospital, that people are now worried that you might get transmission from that individual who they didn't find out until after death, that you actually have Ebola there. So that's the reason that Mali is now. So I don't want folks to get confused. It's still 3 main countries where the thousands of deaths are and thousands of cases are, but it's this one individual in Mali that's now started an outbreak, that's a focused outbreak that folks are now also concerned about. Does that make sense? That's what's happening. That's why you might be hearing more about Mali, and over time we might actually have Mali now added to the list of 3 countries, but right now it has not been added, but there are additional screenings that are happening related to Mali at the 4 or 5 airports that travelers are coming in from across the 3 countries. So here's a little bit of history about Ebola in the US. So our history with Ebola in the US, it starts not long ago. It starts September 30th, right? So you can take the sum of history of Ebola in the US and start from September 30th moving forward, and that's all you need to know. Because essentially prior to September 30th, we did not have any cases of Ebola in this country. So what you have is that the CDC confirmed the first case in Dallas, and we all know that this is somebody who had come over from a Western African country. That individual, Mr. Duncan, wound up dying from Ebola. And after that, Mr. Duncan died, we also realized that there were 2 nurses on October 11th and October 15th who also contracted Ebola at Presbyterian Hospital. And so you had 2 additional, this is your case 1, case 2, and now case 3. Then we had a 4th person who was a gentleman, Dr. Spencer, who came over from West Africa after taking care of patients with Ebola, and he also contracted Ebola. We believe contracted Ebola from Guinea before he got over, but his actual diagnosis occurred here in the US. So that's case 4, and that's all we have thus far. But throughout this period of 6, 7, 8 weeks, all of public health has been, all we've been doing is Ebola. And that's really because we want to make sure we're ready, we want to make sure that we're working with our partners, we want to make sure that we get the information out to the public. And so what's been happening in Dallas and in New York is that there's something called contact tracing. And if, God forbid, this happened in our community, Dr. Deanna Martinez's group would be very busy with contact tracing, which that means is that anybody who was in contact with that individual, you got to find. And you got to make sure any of those folks are being monitored for fever, and when they're being monitored for fever or other symptoms, if they come back positive for something, you get concerned that now he's positive and we now need to isolate him. Oh, and now he's positive, we need to isolate him. And that's how it goes. But if the individuals do not have any symptoms, then they eventually go on their way. And that's how the 21 days works. The other thing that is that it does go for 21 days, and that we're also working to give guidance to our healthcare professionals on infection control practices, the right personal protective equipment, which I'll talk about. And so that's really what's been happening over the last 6 weeks. But it's important to keep Ebola in perspective. So let's start with this. It's a little bit hard to read, but this is a Gallup poll from 2009. Do you guys remember H1N1? Remember? 14 to 34 million Americans got H1N1. That's a lot, right? That's a lot. At that time, a poll was done about how many people were worried about H1N1, and just about 20–25% of people were worried about H1N1. Now, I've said that we had 4 cases. You add in a couple of other cases of individuals who were flown over from Africa who actually were Ebola cases here. Number of Americans that were believed to have Ebola, it's somewhere in single digits. Look at the percentage that are worried about Ebola here. It's just about the same as Ebola as it was for H1N1. That actually was a number of people across the country. The other point to make here is Africa. That's the United States. That's pretty impressive when you think about, in perspective, that the U.S. can fit into Africa, and the outbreak is happening right here. That's in a very small part of Africa, and that there are a number of areas of Africa where people oftentimes feel like, oh, it's all of Africa. It's Egypt, it's South Africa, it must be Ethiopia, it must be Kenya. It's not. It's 3 countries that we're concerned about. So the reason I show the slide is that we need to keep things in perspective. That although there are only a few individuals that have Ebola, yes, it's concerning. We have to keep in perspective that there are not a lot more people that have Ebola, and the outbreak is really concentrated in a very small area. And the fact is that 14 to 34 million people had H1N1. And how many people in the room have gotten their flu shot? Yeah, not everybody. So flu, you're more likely to come across an infectious disease such as the flu and the measles and some other disease than you will Ebola. Yet 20% of people are really worried about Ebola, which is 1 out of 5, which obviously is something we need to be thinking about. So the obvious question, I think you have the flyer in front of you, the infographic here that we put together, is that am I at risk? And so let's kind of park the Molly question to the side for just a second. And what I would say is that it's a very simple message. How many people in this room have been to Guinea, Liberia, Sierra Leone in the last 3 weeks? Raise your hand high. As high as you can. I can't see any hands up. Please higher. Come on, higher. I know you can. The gentleman in the back with the camera? No? Okay, he had 2 hands up for a second. I got a little bit concerned. We need to put him on it. The point is, nobody in this room has been to those 3 countries in the last 3 weeks. And that means that the risk in this room goes to 0. Okay? That's really critical. But if I asked you prior to this, which I did, how many are concerned about Ebola? Half the room had raised their hands, which is good. I want you to be thinking about it, but I don't want you to be overly worried about it. Okay? So what we're saying is that if you've been to these 3 countries in the last 3 weeks and have had some interaction with either somebody with Ebola or the body fluids of somebody with Ebola, then contact your healthcare provider. Okay? If you have not, then worry about these other infectious diseases like the people who didn't raise their hands when they said, did you get your flu shot? Right? That's what you can do today. Don't be worrying just about Ebola. What you can do today is show up at your pharmacy or show up at your doctor's office and get a flu shot. You can do that. But let's do the things that we can take care of and not just be concerned about all the things that we may or may not be able to really concern ourselves with. It's really important to remember, where is the outbreak occurring related to Ebola? West Africa, right? We will never get to what I call theoretical risk 0, which means 0 risk in this country, in our community, in Harris County, until we contain the outbreak in West Africa. So we cannot undermine any efforts to do that. That means if healthcare workers are trying to get over there to try to help, we got to support them. If that means that we've got to find a way to try to get resources over there, we've got to support it. Because we will never keep our Harris County residents to zero risk until we contain the outbreak in Africa. So just keep that in mind as well. So what we're also doing now is that all the travelers from those 3 countries are now being funneled into 5 airports. Okay? They're being funneled into 5 airports, and they are in DC, they're in New York, they're in Chicago, Atlanta. That's where all the visitors are being funneled into, okay? All the travelers. This is not just visitors, it could be business travelers, this could be people that are going over there for work purposes, etc. They're going to those 5 airports, and they're getting screened at those 5 airports by the CDC and other federal partners. They're being given an Ebola kit, and what they're being told at that time is that if you get fever in the next 3 weeks, contact your local health department. Now, on the other hand, the local health department is getting the information. We're actually getting the names and the addresses of the individuals that are coming over, and so we're contacting the travelers, we're doing another evaluation and screening, and we're monitoring for the next 3 weeks. And so we have people in Harris County right now who have traveled to one of those 3 countries who are now here in our community that we are currently watching for symptoms. It happens that they're all in low-risk categories or no-risk categories, but just because they've been to those 3 countries, we're keeping track of them. So that's an important thing that all of us have to remember. But again, the message is really this one, that if you're not in those categories and you've not been into these 3 countries, then you really need to keep mindful that you go on with your day and you keep just looking out for the information that we're giving to people. So let's talk a little bit more about the response. So I talked to you about the healthcare providers, right, being the doctors and the nurses. I see the healthcare providers as the real heroes, the front line of the Ebola response. That's where things happen, right? Clinics, ERs, urgent care, hospitals, that's where you have people that are really coming in for Ebola-related symptoms, but they may be coming in with a symptom of a stroke, of a cold, of the flu, or they're bleeding, or something else is happening, or they've got some other issue that they're being screened for, or diagnosed by their healthcare provider. And so it's really hard. Have you ever been in the emergency department watching doctors and nurses trying to figure out what somebody has and how busy it can be? It's easy to see how quickly things can get out of hand. And so the front line is really our healthcare system. Public health is behind the scenes working to assist the healthcare system, and our assistance is really on emphasizing the prevention of the spread of disease, which means that if you have somebody who has symptoms that might be consistent with Ebola, you quickly isolate them. When you have a possibility, and now you've definitely said this person has Ebola, you definitely want to do a contact investigation. And all along, you want to do infection control. Because the key that you want to do is you want to interrupt the spread of disease from one person to another to another. So even if we have a popcorn effect, where you have one individual that popcorn all of a sudden has Ebola, you just don't want it to be that you have other popcorns that are going along that other people wind up getting Ebola. You want to stop it at that one kernel, and you don't want to go any further. I think Orville Redenbacher wouldn't be very happy about that metaphor, but I just thought I would throw that in there. So infection control is really important to remember, and I won't go through this because it's a little bit over much for this group, but just to let you know that the guidance has changed. The CDC had guidance on what folks should be wearing in order to be taking care of somebody with a confirmed case of Ebola. The guidelines have now changed, and so it's markedly more essentially putting the person in a more comprehensive way of protection, but it also includes some things related to having a second person watching that person put the clothing on, take the clothing off, donning and doffing, donning and doffing. You have to have 2 people doing that, and you also have a third person who's watching the whole process. So there are a few things that the CDC has now put in that have evolved over time. So what we as a department have been doing have really been, again, identifying travelers from the affected countries, guiding our healthcare providers. We've been really busy with ruling in and ruling out. What does that mean? Ruling in other diseases, because we get calls. We think we have somebody with Ebola, turns out it's malaria. We think we have somebody with Ebola, turns out they went to Nigeria. So we have to help rule people in and out, helping with our healthcare system, and at the same time coordinating laboratory testing for evaluation purposes. What does that mean? Every person that comes in with suspect of Ebola does not have Ebola, right? Nor does every person get an Ebola test. So another confusing message we've given to people is that you have to get an Ebola test to rule out Ebola. No, you don't. If somebody comes to me and says, this gentleman, he's got Ebola, and then I start talking to him and I say, well, when was the last time you went to these 3 countries? Well, doc, I've never been to these 3 countries. Well, guess what? He's not getting an Ebola test because we've evaluated him from a travel history perspective and we've been able to rule it out. So just because somebody puts him in the category of an Ebola suspect doesn't mean that it needs to be a test. So don't get confused by that, because I've been pushing the message that it's an Ebola evaluation, which might include a lab test, but it might not. Okay, just keep that in mind. And then the final thing is that obviously communicating around PPE, the personal protective equipment, and isolation. The other thing that we've done is that we establish an Ebola readiness team. Now, what's the first thing that we always do when we have an incident? We establish a response team. So why did Dr. Shaw call it a readiness team? Because I wanted it to be clear that we have 0 cases of Ebola in our community. We're not responding to Ebola, we're getting ready in case we had Ebola in our community. So it's a readiness team. And certainly we're this close and very quickly can spin up to a response team if necessary. But we've been doing twice daily tag-ups. We've now gone to once daily. I think my staff are happy. I spent several weeks with twice daily with our staff on weekends, and I really want to give them credit because they were fantastic about taking time out of their schedules with their families, etc., even on Saturdays and Sundays, so that we could make sure we were on top of the response. And it's been challenging, but really what we've been doing is just to make sure we have all of our information together. We've been reviewing all the legal stuff, health authority activities, if I had to quarantine somebody, if I had to isolate somebody, and then making sure our contracts are okay. Well, how do we get somebody transported from this institution to not that institution, from home to a hospital with the right contracts, and then certainly supporting our frontline staff with their activities. And with our external partners, we have been working with our federal, state, regional, and local partners. And our local partners include, obviously, Harris County Commissioner's Court. Judge Emmett is Harris County Judge. He oversees Harris County Office of Emergency Management Homeland Security under Mark Sloan. I don't know how many people in the room. I think a few people might know Mark. And so they're very much supportive of the activities that we're doing at the health department. And we're also working with the City of Houston, other communities within Harris County, law enforcement, Texas Medical Center, and obviously Harris County Medical Society, and all sorts of partners, including Harris County Department of Education. See? I knew I was going to put that in there. Hey, very nice. So, what we've also been doing is we've been busy putting together these fact sheets. And so this is your community, educational settings, healthcare providers, business, your pets. We've put these together. So there are a lot of these informational pieces of materials that we've adapted. These are de novo. We've created these so that we thought they would be very helpful for our community. Please look at them. I know you especially are interested in the educational settings one. And hopefully we can ask some questions if you guys, answer some questions if you guys have some. We also put together these 2 infographics. Remember, if you've been to 3 countries in 3 weeks and you have one of 3 things, you either have fever, other symptoms, or had bona fide confirmed interaction with somebody with Ebola, not somebody at the gym that was sweating a lot. I think that person had Ebola. No, that person doesn't have Ebola. That person's just sweating a lot. These are the kinds of questions that we've gotten, but these are infographics to help our community understand about Ebola. And then the last one that we've just put on as well, which is it flu or Ebola? Which is another one that's really important because we're now into flu season, and we want to make sure people understand that as well. We've also done the same for our healthcare providers, so we have an Ebola assessment tool that they can have up in their emergency department so they can look and see what are the kinds of questions that we want to ask. So I'm going to wrap up with just a couple of quick slides here, is that what can you do to help? So first of all, you can be very attentive, which you've been, so fantastic. Check, you did the first thing. But the second is that you can help partner with us. Be our partners. Look at the materials that we have. Spread the materials to others, right? Spread the materials to others, because the biggest combating that we can do of Ebola is all the myths, the hype, the other activities that are out there that are not helping anybody understand Ebola better. What we want people to do is to spread this information to their colleagues, to your schools, to your families, to your neighborhoods, to any volunteer groups you go to your faith base, anywhere. If you're going to go on Sunday somewhere, you're going to watch the Texans lose to Cincinnati Bengals because I'm from Cincinnati. Oh my gosh, did I say that? I did not mean that. We're going to watch a very competitive game on Sunday. We're going to talk about Ebola in a very factual way. By the way, I'm a huge Texans fan as well. And I just want you to know that it's really important for us to get the information out that we've got on our website. The CDC has on its website, which is up here, but there are a number of other partners, so please look at our website, the CDC website. Our website has a ton of links that gets you to other different websites as well. And then sharing that material with others. And then make sure that you provide informed, calming message of compassion and support. And this is really critical. We have about 7,500 individuals from Sierra Leone, Guinea, Liberia in our community today. Do you realize how difficult a time this is for them? They've had families that they've lost back home. They're being told you can't go back home. They're being told things about. I actually had somebody who worked at a store. When I shook his hand, he said, "You're the first person who's shook my hand in 2 weeks." I mean, think about that. People quickly isolate and put somebody in other categories. You just have to realize that when you have somebody from one of these countries that you're with, please reach out to them. Take an especially extra effort to reach out and make sure that you understand that they're part of our community as well. And so, with that, the last thing here is that I always like to end with saying that the role of public health makes common sense. This is from Katrina in 2005. I was much younger. All right, that didn't go over very well. But it was an official Form 214 that I had actually put up to our incident command, because we didn't need another something and another something and another this and that and all these widgets and tools and other things that cost a lot. What we really needed was just a little bit of common sense. And so I think we need to keep that in mind with Ebola as well, is that this is really about keeping common sense and keeping things in perspective. You're much more likely to come across another infectious disease. You have to get your flu shot. You have to do the things you can do for your own families and your communities. Ebola is one of the things that if we did, let's say, knock on wood, we don't, but if we did get Ebola in our community, the public at large would still not be at risk, even if we had a case of Ebola in Houston, Harris County. The public at large would not be at risk, only the people that had interacted with that individual. We got to keep that in perspective. Last thing, my Twitter handle. How many people are on Twitter? All right, follow me. I'm up there now. I don't know what that means, but I'm up there. I'm tweeting. I'm trying to figure it out. And that's all I've got. I did want to grab Dr. Martinez for just a second, if she could just come out, because I want her to be able to say a couple words. And then we'll just open it up. Do we have time for a couple of minutes of questions? And Deanna will just want to say a couple things about Ebola and working with your healthcare nurses, your school nurses.
Hi, yeah, I'm the epidemiologist for Harris County Public Health. We have a team of wonderful staff and epidemiologists, and we respond to all sorts of notifiable conditions, not only Ebola. We have a long relationship with your school nurses. So anyone here a school nurse or associated with a school nurse? But I know you know your school nurse. They're very important in the school community. They know a lot about how to reach to us. We work particularly with the health coordinators as well, and to the school nurses through them. A lot of what happens in the relationship with our department, with the schools, is that it's unfortunate that we get involved with their infectious diseases and sometimes fatal infectious diseases. And what I get over and over again is that it's an unusual time for the school. It's difficult for you. You are there with the parents, and it is kind of routine for us because we deal with this all the time. And so we can share with you information to do the calm messaging that Dr. Shah talks about. These things are sad and difficult, but oftentimes not necessarily pose a risk to others. And if they do, we identify who those are at risk, and we have things to help with. So we're here to help. We have a great staff. We have epidemiologists on call every day of the week and night. So if there is a question in your community, in your school, you can reach out to the health department, and we're here to help. So I think that's my message. Do you have any questions for Dr. Shah regarding Ebola?
Cincinnati's going to lose.
Cincinnati's going to lose? Oh, my gosh. Let's hope so, right? Let's hope so. So any questions? I like to try to keep things light because I do think it's important for people to get information but not to get worried and scared about things. But we're here if you have any additional questions. You don't have to even reach out today, but it's important for you all to be able to ask anything if you have any questions for us.
I hate to say it out loud because it makes me look like not as smart as I really am, but on the TV, internet, I heard somebody who was trying to raise a bunch of trouble say, well, I could just if I had Ebola and I had blown my nose and I had goo on my hands, I put it on a desk and I walked off and then somebody else came and touched it, then they would get it. Tell me why that is not true.
So that's a great question. I think the first thing is you have to keep in mind is how many cases of Ebola that we have in the U.S. So let's keep that in mind. That's the first perspective, is that we have 4 cases, we have 300 million people in the country. All right? My chances of being in the NBA next year are actually probably a little bit better. In fact, I even saw a study very recently that said that, you remember in Roadrunner where the furniture comes out of the window and it falls on his head all the time, or on the coyote's head, right? And it always says Acme, some brick or something falls, right? But I saw this study where 30 to 40 Americans every year die of furniture falling on their head, which is more likely chance than having Ebola. So I think it's important to keep it in perspective. So first is you always start with keeping it in perspective. And then the second thing is that it is possible that if somebody has symptoms with Ebola and that they had some some fluids that were on a piece of furniture, and then you touch that, within some minutes, we don't know how long, whether it's an hour, 2 hour out of the body, it's got to be the exact right temperature. It is possible that you could have transmission that way, but you always have to keep it in perspective that the likelihood that fluid, any fluid in this country to have Ebola is almost 0. And so do you want to worry about things that can't happen as often, or do you want to worry about things that are more likely to happen? I also just wanted to say that I did look up that Mali is kind of the country going northeast. It's that small purplish going from Guinea going northeast, and it's the reason why it didn't look quite right was because the map is actually a little bit smaller than that. It's focused in. Mali actually is a much larger country. It's just that the map is focused down, so it looked a little bit unfamiliar.